Good day, everyone. Today's article is titled Histopathology, Diagnosis, Management, and Treatment Outcome of Cemental Tears, a retrospective observational cohort study. It was done by Lee and others, group from Hong Kong, and was published in IEJ in 2026. Cemental tears are a rare clinical condition where a fragment of cementum detaches from the root surface. They are difficult to diagnose because they mimic other pathologies like vertical root fractures or periundual lesions. The exact cause is unknown, but suggested factors include age, trauma, closal stress, and previous endo or peri treatments. Both histopathological and clinical inspection are the gold standard for definitive diagnosis. However, these methods are employed after initial clinical and radiographic assessment. Accuracy of these diagnostic methods require further investigation as there remain a potential for misdiagnosis. Treatment approaches suggested in the literature for cases of the cemental tear includes root canal treatment, surgical or non-surgical period treatment, intentional replantation or extraction. So the aim of this study is to evaluate cases using a specific classification system that was proposed by the same primary author in 2021 to assess diagnostic features, clinical, radiographic, and histopathological, and identify factors influencing treatment outcomes. For the materials and methods, a retrospective cohort study evaluating 45 teeth from 37 patients diagnosed with cemental tear at a university endodontic clinic between 2019 and 2024. Cases were evaluating using PAs, CBCT, and direct surgical inspection. And then the teeth were classified into classes from 0 to 6 based on the location of the tear, presence of bony defect, and apical involvement. Management include non-surgical root canal treatment, surgical debridement, apicoectomy, or intentional replantation. Regenerative techniques such as bone grafts, membranes, and enamel matrix derivatives were used in selected cases where the decision was influenced by specific criteria, including the presence of an infrabony defect, cervical cortical bony plate thickness less than 3 mm, a bony crypt size of 10 mm or larger, through and through bony lesion, and the presence of periundual lesions. Biopsies, hard and soft tissues were analyzed using polarized microscopy to confirm the presence of cementum. For the results, the most affected teeth were maxillary incisors. CBCT, direct inspection, and histopathology detected 100% of the cases, whereas PAs only identified 60%. And clinically, approximately 44% of patients presented with pain or swelling and sinus tracts. And severe crestal bone loss of 70% or more was found in 53% of teeth. When they assessed the outcome by classes, class 1 to 3 lesions, those with extensive apicomarginal defects, have a very good chance of healing with combined endo-peri management, whereas class 4 to 6 lesions, those with infrabony lesions and apical involvement, have a poor prognosis, where almost 79% showing unfavorable results, regardless of the method. And the use of regenerative approaches showed limited success in these advanced cases. So the authors emphasized that PAs often fail to show the fragment due to overlapping structures or a small size of the tear, making CBCT essential for early detection. The classification system developed by Lee in 2021 proved to be a strong predictor of success. Apical involvement and accessibility of the lesion, those in classes 4 to 6, are the primary drivers for treatment failures. And for the regeneration approach, the study questions the routine use of regenerative materials as they did not significantly improve outcome in high-risk classes. This paper has some limitations. First, the sample size within some classification stage subgroups are considered very small, and also unblinded assessment where the assessors were aware of the suspected diagnosis and treatment modalities, which could introduce information bias into the radiographic and histopathological evaluation. And thank you so much.